The US's vaccine program is the envy of much of the world, with over 3 million people getting the jab every day. But the virus continues to spread quickly. States like Michigan are especially hard hit, causing some to call for tough medicine.
The answer to that is to really close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down.
With 70,000 new infections each day, vaccines alone might not be enough to turn the tide in the fight against COVID-19. No other country in the world has been hit harder by the coronavirus. The United States has had the most confirmed cases and deaths in the world. And despite its unprecedented vaccination program, those numbers are still rising. Many people have grown weary of lockdown, and with warming weather, many states have lifted restrictions. Facing the threat of a fourth wave, President Joe Biden's administration is doubling down on vaccination as the key to ending the pandemic. But local outbreaks threaten to undo that strategy. John Brooks joins us from the CDC, the Centers for Disease Control and Prevention. How would you say the US is coming along? There's been a change in leadership, a change in the weather, but has there been progress in the fight against COVID?
Well, I think there has been steady progress in the fight against COVID, even since we began. And this is despite 3 waves, including a really unprecedented third wave over the holiday season. But we're coming down off the back of that wave right now and really getting the numbers down quickly. We're not succeeding yet. I mean, we're making incredible progress, but the number of new infections we're seeing in this country remains about what it was during our second wave last summer. So at about 50,000 new infections a day and 500 to 1,000 deaths a day. But
and the numbers certainly look promising when you take a look at who's been inoculated. A third of the population has got at least one jab. That's over 120 million Americans. But with the focus on getting people vaccinated, what about new restrictions on the economy? Because there's a new wave of coronavirus cases, as you mentioned, and hospitals are getting crowded.
Mm-hmm. That's right. And this, we want to reserve using those really most difficult decisions of shutting down the economy to when we have to apply them. But it's becoming apparent that we may be at a place where in some jurisdictions, certain states, it may be time to sort of shut down a little bit to gain control over this virus. I mean, we're in a big race right now, right? We are racing against the virus with vaccine. And we've got to get the vaccine out as soon as possible. We're asking people to hold on a little bit longer. We know it's frustrating. It's been a rough year. People want to get back to the normal life they enjoyed before. But we're not done with this race. We're not done with the battle. And we're going to have to hang on till we can really get vaccination out.
But, John, is that message getting through to state officials? Because in Michigan, the state health director says the government's focusing on getting more people vaccinated rather than imposing new restrictions on the economy.
Well, it would be wonderful if vaccination took effect immediately, but it takes a couple of weeks for you to benefit from vaccination. With the BioNTech vaccine, it's 21 days between doses plus another 14 days until you're fully covered. But they're seeing a problem right now. And to deal with the problem right now, you need to cut off the chains of transmission with whatever you have at your disposal. And unfortunately, at this time, the best means for that would be slowing down on the reopening of society there.
So which states would you say are getting it right, which are getting it wrong? Because, again, despite all those vaccinations, the 7-day case rate per 100,000 people is at 515 in Michigan. California's only at 50.
That's right. And it's interesting. It's also very low in, I believe, states like Texas and Florida, where one might have expected that it would be higher. So we don't understand exactly why the rates are different in different states. It's probably some combination of the fact that some states have gotten more vaccine out. They have more social distancing measures still in place. The government and political opinion is aligned with public health. So we're all singing from the same songbook, we say, right? That we are all working together and not against each other.
What about herd immunity? Is there going to be a stage where the US will reach that?
Yeah, I mean, I'm an infectious disease doctor. I've been working in this area for 30 years, and I'm certain that we will reach herd immunity. I just don't know what that number is. We'll know it when we get there because there will be a sustained decline and then leveling off of new infections. And that will be the point when there have been enough people vaccinated, as well, unfortunately, as people who've recovered from illness, that the virus can't find anywhere else to go.
And that also depends upon whether or not the virus manages to mutate in a certain direction.
That's absolutely right. We're watching that very carefully. I mean, these mutations, these variants, they're called, really concern us a lot. And vigilance really matters when viruses vary. So we've put in, oh, I'm sorry, go ahead.
No, that's okay. What were you going to say?
I say we've put into place a very, very large national effort to routinely screen a large number of these viruses now to monitor for variants and to identify those mutations which either make the virus more transmissible, may increase the severity, or undercut some of the activity of drugs that we use against the virus.
Okay, on that very topic, I wanted to just mention some Americans are already getting a third dose, which will be news to some people around the world. They're taking part in a study of updated versions of the coronavirus vaccines, and they've been tweaked to tackle mutations of the virus. A variant discovered in Britain just months ago is already the most common version of the coronavirus circulating in the United States. Current vaccines offer strong protection against these mutations, but researchers want to be ready to respond to new threats that emerge, of course. That study is being run by the National Institute of Health and Emory University in Atlanta, I believe. John, which is where you're based, these sorts of tweaks can be achieved in a matter of weeks. It's the regulators that hold back the process by months. Can and should that be changed?
Well, I think there'll be a lot of urgency to find a pathway forward where we can make these changes and adopt these regulatory changes as rapidly as we possibly can, while, of course, maintaining the safety of the public who will be receiving these vaccines. You know, we have annual flu vaccination. Now, in that case, every year, the World Health Organization and other public health organizations around the world look ahead as to what may be coming. But we have a different situation now. We have these mRNA vaccines from BioNTech and Moderna and other companies that you can custom create the vaccine with mRNA relatively quickly, and then it takes probably weeks to a few months to get that into production. I believe that given the experience with this pandemic, we're going to hopefully see regulators moving just as quickly with us.
That's that would be nice, John. Can you give us an outlook? Is there anything else that you can leave us with that gives us some sort of hope in this crisis?
Well, I'll just say this. I mean, our Food and Drug Administration is the organization in charge of these regulations, and they have experienced this pandemic just like we have at our agency, which is in charge of things related to prevention. And I think that there is a strong desire to move forward into this future in a way that we can keep the public safe, but respond more fleetly. We've had some bad experiences where we weren't able to respond as quickly as we'd like, and it's clear that that's going to be an important thing in the future.
John Brooks from the CDC, thank you very much for joining us today.
It's my pleasure.
In another setback, the United States has recommended putting the Johnson & Johnson vaccine on hold. It's investigating a potential link between the jab and blood clots. Nearly 7 million people have received the single-dose vaccine in the US. Clotting was reported in 6 women in the days after vaccination. Several countries have also restricted the AstraZeneca shot over clotting fears. Over to our science correspondent, Derrick Williams, who has an interesting viewer question about the vaccine and hospitalizations.
How come people hospitalized with COVID-19 don't get the vaccine? Couldn't it save their lives?
No. Although ongoing research into what are called therapeutic vaccines is fascinating, the approved COVID vaccines are traditional in the sense that they aren't therapies if you already have COVID-19. They're a measure to prevent you from contracting it in the first place, or at least ensuring that if you do get the disease, it'll be a milder case and you won't end up in the hospital. The reason the pandemic went global so fast and spun so quickly out of control is because SARS-CoV-2 was a novel pathogen that no one had been exposed to before, a state that experts call being immunologically naive. The vaccines now in use basically teach your body that there's a bad bug out there that looks like this, so that if it shows up in your nose or throat, your immune system is forewarned and can jump on it quickly. But just like it takes time for your immune system to respond if you're infected for real, it also takes time to ramp up an immune response to the fake infection that a vaccine simulates. A couple of weeks, give or take a few days, depending on the vaccine. So giving someone who has a severe case of the disease a vaccine won't help and could likely do harm. That's why trusted healthcare authorities like the Centers for Disease Control recommend that if you have COVID-19, you need to wait a while after your symptoms have completely subsided before you even begin to consider getting vaccinated.
Finally, surging coronavirus cases in many parts of the world are overshadowing the start of Ramadan. South Asia's nations are battling a spiraling outbreak. Europe has passed 1 million deaths. The Muslim holy month is a time of avoiding food and drink during the day and coming together for feasts at night, both a challenge during the pandemic. Indonesia has the world's biggest Muslim population, and people have been attending socially distanced services in mosques. Its Islamic body now says COVID vaccinations do not violate the fast and are permissible under the religious law. A relief for the government, which has been counting on a vaccine drive to tackle the largest number of infections and deaths in Southeast Asia. Thanks for watching, stay safe, and see you again soon.